Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah. Hi, hello, all. I'm Dr. Sathish. I'm the consultant neurologist in KMCH, Coimbatore. Today we are here to discuss some new facts about this epilepsy. So, what does really epilepsy means? So that is what we are going to have a discussion on today.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah. So a seizure is nothing but an excess of electrical activity happening inside the brain. So your brain is nothing but a neuronal circuit. It is like an electrical circuit, as like any electrical circuit for that matter. So if there is any short circuit happening within the neuronal connections, it is going to manifest as a excess of activity, and that is going to mimic as a seizure. So seizure is nothing but it can manifest in various ways. It is not just a tonic-clonic movements as we all see, like as we all, I mean, in day-to-day life we see people having shivering movements of their hands and legs and becoming unconscious. It is not just that. Okay, so a seizure can be in a different way. A patient or a baby, it can happen even in childhood or it can happen even in older age groups. So there is no age limit for a seizure per se. But usually seizure starts within 25 years of age. So these seizures which are happening within 25 years of age usually mimic with that of a shivering movements which we see in our daily practices, or a patient can have just a staring look without moving his body or without speaking for a few seconds or few minutes, and that can also be a seizure activity. So this is actually a seizure happening because of the excessive electrical activity happening within the brain circuits.
What is epilepsy?
So, see, a seizure turning into an epilepsy is totally different. So, seizure is a one-time event, whereas an epilepsy is something which is going to happen within a 24 hours if you have two episodes of seizure, and it should be an unprovoked seizure. So, see, what I mean by unprovoked is, see, as I told, there can be an excessive electrical activity. That excessive electrical activity can be due to various reasons. So our body might have a high sugar values. A patient with a high sugar values can have a seizure. A patient with a low sodium or a high sodium can also have a seizure. But there should not be any of these factors to call it as an epilepsy. An epilepsy should happen in a normal individual with a normal lab values, and the brain imaging should be normal. The brain imaging should not show any humor in it, or it should not show any. So in such brain, if there is two events of seizure happening within 24 hours, we call it as an epilepsy.
What are the different types of seizures and do they affect people differently?
Yeah. So we have different types of seizures. So we have something called as a generalized seizures, and we have something called as a focal seizures. So this generalized seizure is where you have a total loss of consciousness. So the patient is not aware of what is happening around him. He's going to have an active convulsive movements, like he's going to have a tonic clonic movements. He's going to harm himself, like by falling down, and he's going to. Whereas a focal seizure is a one, we can divide focal seizure into two types. That you can have a focal seizure with intact awareness and a focal seizure with a loss of consciousness. So in focal seizure with intact awareness, the patient himself will be aware, like he'll be having a tonic-clonic movements of only one limb, but he'll be aware of it. Whereas a focal seizure with that loss of awareness can have a tonic-clonic movements involving one limb, and the patient will be totally unaware of that event. So each seizure has its own treatment, and we have a protocol for each seizure. So it
Definitely.
happens in a childhood as well as in
Yeah.
adulthood. Okay, so those which are happening in childhoods are usually we are usually epilepsy syndromes. Okay, so that is happening within 25 years of age. Those which are happening after 25 years of age, we need to evaluate for it. Like any other factors, whether the sodium is low or the sugars might be high. So those factors needs to be evaluated as the age progresses.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So epilepsies are usually epilepsy. The term epilepsy is usually a genetic term. Okay, so it is usually a genetic. So it is inherited. So it can happen in families. So if a baby is born to a parent who is having a seizure, then that baby can have an epilepsy in future. Okay, so
Yeah.
it can be a genetic or it can be some other factors, like as I told you, metabolic factors like high sugars, low sodium, low calcium. So those seizures which are happening in neonates or in pediatric age groups are usually genetics. They are genetic.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So this is very important. Like, see, as I told you, not all epilepsy or not all seizure is going to present us with these convulsive movements, these chronic movements. Some seizures, the baby might be staring at a particular object. They might think that the baby is daydreaming. It is not actually a daydream. It is a seizure event. So those patients with this violent activities of tonic-clonic, the
Yeah.
caregiver should be very careful about that because the baby might injure or the patient might injure themselves. They can have a tongue bite. At that time, we have to be extra cautious. The caregiver should not insert anything into the mouth, especially the hands inside the mouth, because they will not be aware of it and they might bite the caregiver's hand also. It will be so violent that they can injure the caregivers. So the thing is, the caregiver should do is they have to place the patient in a lateral position, in, either on the left side or on the right side. It should not be in a straight position. If the patient is in a straight position, they might aspirate their own saliva into the. So it should be in the lateral position, and
Yeah.
some cloth should be inserted inside the mouth. It should not be a hard object which can impact their teeth or their tongue. So a cloth like thing can be inserted inside the mouth.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, see, this epilepsy is usually taken in our setting in India. It is a stigma and it's still a taboo in most of the developing nation for that matter. We take epilepsy for granted. We take it like it is like something has entered into the body. So it is mostly it is taken as a spiritual thing, like something is happening to the patient and it is taken as a spiritual thing. Actually, that is not the case. It is purely medical and it is purely neurological. So any patient who is having this convulsive movement, it is there is a taboo like if you give anything iron in the hand, this seizure
Yeah.
is going to stop. It is not like that. Any seizure for that matter will abort in 2 minutes. If it is extending beyond 2 minutes, we call it as status, which is not going to abort unless you're going to intervene by giving medications, right? So any seizure for that matter is going to abort within 2 minutes, and if it is going to last more than 2 minutes, we are going to call it as a status. So do not give any heavy objects or metals in the hand of the patients because it might harm the patients, like all the caregivers also. Okay, and that the patient, like the public should have the awareness that a seizure is not a spiritual event, or it should not be taken as a taboo. See, the
Yeah.
patient and the caregiver should have that awareness. A seizure is a medical event and it should require a proper medical care.
How does this stigma affect people with epilepsy?
Yeah, ma'am, definitely. Because see, people tend to think that seizures will come once in a lifetime and it goes, and they never seek a medical attention. If it is going to happen, no, like the seizure
Yeah.
can happen at any time. A patient might be driving a bike, and if he throws a convulsion, it is not only going to harm him, but also the uh, person who's coming opposite to him while driving or while standing in terrace. He might throw a convulsion, he might fall down. So we see a lot of patients getting injured without having this awareness that seizure is a medical event. They tend to think that it is something spiritual, and it is often considered as a taboo. Like if they speak out that they are having a seizure, the public might see them as a different. No, it is not like that. It is just like a diabetes or a hypertension, where you give a tablet, where you give a medication, and you can control your seizure. Those seizures which are not going to get controlled with medication, here again, advances are there in medical field where you can go for epileptic surgeries and you can completely cure that seizure.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, so the most common trigger will be lack of sleep and alcohol consumption. See, alcohol consumption can trigger a seizure, and after consuming alcohol, binge drinking of alcohol, and abruptly stopping alcohol can also provoke a seizure. And lack of sleep. So any seizure patient, for that matter, should have an adequate sleep of at least 8 to 10 hours, and they should not be exposed to excess of lights. So this flickering lights can also provoke seizure in patients who are prone to have these epilepsies. Especially we have certain epilepsy like a juvenile myoclonic epilepsy, which usually happens within 20 years of age. These are highly photogenic seizures. So like when they are exposed to these camera lights or exposed to a long these mobiles and flickering lights, no, that can provoke a seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yeah, so the lifestyle management, as I told, no, like adequate sleep is very important, and there are no restriction of diet or food as such. But especially this fish fat and fish oil, no, it has a very good thing to develop your neuronal circuits, because this the neuron will be covered by a layer called myelin. In order to improve that myelination, we suggest the patients, especially patients with epilepsy, to take a lot of fish products and sea products. And for those who are not going to consume non-veg, we suggest them to take a lot of lipid in the sense ghee or something like that, which is going to myelinate your neuronal cells.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, man. See, the main thing is do not give any heavy metals in the hands of the convalescent patient. Place the patient in one position, either left or right, never in a narrow lying down position. And always do not place any heavy metals inside the mouth, as it might harm their teeth as well as the tongue. So roll a piece of cotton or cloth and try to insert it. Never insert hand inside the mouth.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, ma'am. So as I've already mentioned, see, epilepsy is treatable. It is treatable. See, some
Yeah.
seizures are not completely curable. Curable in the sense, if the patient might be on a long-term medication. So the patient and the caregiver should be aware that it is a treatable disease. It is not. It is more like a diabetes or a hypertension. So it is treatable. So any patient with a seizure, please seek a doctor's help rather than keeping the patient at.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.